My name is Mercury. My surname is Duma. When I was born, I was given a name, Nonkulego Precious Duma. Please don't call me those names, I beg, because I don't identify with those names. I don't identify with the gender pronoun that I was given at birth. My pronoun is he. Please, when you see me, call me he. My pronoun is very important to me, and my pronoun defines who I am. And I'm a transgender man. I work with my community. I'm a writer, I'm a playwright, I'm an editor, and also I'm a poet. And I work with a lot of young people. I work with kids, and I also work with older people. And I would just like to see South Africa that is for all of us, and South Africa that means one thing to all of us, where trans rights are actually human rights. Sometimes messenze indoors for people in our communities, you looked at first as umuntu who has lost their minds. For me, seeing the faces of kids when they are happy and saying, Kulu or Mercury, I can now read, I can do homeworks now. Someone who's doing grade 3, coming back and saying, Ubuyile, let's continue doing the work. It means something amazing, because that means that the child appreciates the work that I do, and the parents also appreciate the work that I do. The dream that I have would be for trans people to be treated like human beings. We are human. The way that people treat us in the streets, when they look at you and they think you are a freak, they think that something needs to be done, they think that you need a ritual, and our healthcare services are not doing us any justice. Transitioning in South Africa is literally a privilege to some people. Some people don't have that luxury. Apparently it's called a luxury now. It's not. So my dream would be for us to be treated as human beings. Because when you're treated like a human being, you feel like a human being. You're no longer scared. Because right now we're scared. I've read this book by Anda, and it's called Becoming Him. And in the book, he speaks excessively about transitioning, the struggles of transitioning, getting medical aid schemes to be able to fund you, because it's a cosmetic surgery. So if something is cosmetic, it means you don't really need it, but you can get it if you have money, which is something us as trans people, we look at and we're like, but I really need that thing, but I cannot have access to it. It makes you as a human being crave someone's body, because you're like, I could be like that. I could have that beard. Oh, I don't want this breast, but at some point you'll need to be comfortable with them, because there's literally nothing you can do. Chances of transitioning maybe will never be a reality. It's a war every day. Waking up, looking yourself in the mirror, still being in the body that you don't identify with, and having people mispronouncing you and calling you she, and having to explain to them why you want them to call you he, and experiencing discrimination, not from your community only, not from your family only, but within the LGBTI community. Because for me, it hurts. It hurts. Seeing our community also discriminating us. The queer community, our small community. So now we need to find other safe havens as transgender people. So it's not fun. Waking up in the morning, looking yourself in the mirror, the body that you have is the body that you don't want to be in, but you have no choice, because the policies that are there, they've made you stuck. The improvements I would like to see in the healthcare system would be the accessibility of the treatment that you need. Also, whenever there's a health issue or there's a health care issue that needs to be addressed, the government always steps up and have programs, and also programs that are making it easy for people that are going to come there to access healthcare. Right now, there's COVID-19. So, of course, facilities are what's COVID-friendly, Also, why can't the healthcare system do that also with transgender people? It means that a lot needs to be done by our healthcare system to meet us halfway. Because truth is, we need them. We need the government. We're born after the struggle, So the only thing that we were ever told was the struggle. So in our head, political rights are very important because it was through politics that we found democracy. So politics plays a major role even where we come from. And right now, looking at our political structures, I don't find myself in them. I don't see any organization that stands up for me. They're just selling us a dream. Yes, they put us in their memorandums, they put us in their plans for the upcoming years. We all get excited, but never happens. So where can you find representation? But for me, political representation is important because we need each other as much as I need other people. But now it looks as if we're just getting further and further away from each other. It's every man for himself. And I doubt that as trans people, we're going to find political representation anytime soon. My plea to stakeholders would be to listen. We are making a lot of noise as a country, but no one is listening. How many times should we walk down the streets and march? How many times should we have these days where we're celebrating transgender rights, but is everyone listening to what we're saying? Are they listening? Are they really engaging in conversations? Look at how everyone is engaging in conversations with regards to COVID-19. We just want to be heard. We want to be seen. Everyone is being seen. Everyone is being visible. Why can't we just be seen and be heard? And having a seat at the table will be a first step in the right direction. It's funny how people change their mindsets when you're doing something good for them. Working with the community, I will say that they don't understand me. They don't want to engage in those conversations because I help them. When you help, it's easy not to be questioned because they've accepted me, and acceptance speaks to empowerment and it speaks to power because now people respect you. What happens when you do not help them? What happens when I stop helping out the community? Are they suddenly going to show their true colors? I constantly live in fear. It's very comforting knowing ukuthi ngisafe. Ngisafe. Like when I'm ngasekhaya, I know ukuthi I'm very safe because everyone respects and actually likes me. But I don't know how much of that like would be when it's dark. What will happen when it's dark? And I'm in a vulnerable position. Will they still say, no, don't touch this person or don't do anything to this person because this is who she is or this is who he is? I still live in fear, even within my community where I feel safe. Am I really safe? Or I'm just thinking that I'm safe? Or have they made me think that I'm safe? In the world imagined, in the valley of death, I ran for peace. I should have been called a boy. I should have been called him. I should have. In the world imagined, in the valley of death, I ran for peace. Should have been called him. Should have been called a boy. I should have.
Sanibonani, igama lami nguMelissa Nwagambambo, ngihlala eNjanga. I was born in 1985. I am a beauty queen, also a healer, a student, a makeup artist, hairstylist. This is who I am. I'm a black trans woman. Ongasabi ngobien. The services that we have in South Africa, as you know, I'm from KZN, Mina, the only place that I can easily access my hormones, it's Grace Hospital. Where it's easy for me and easy to access them. Because you don't go my hormones. You need to go to do a process to see psychologist. When is in dining? And then you start your hormones. And the way, since I'm about some surgeries, we need to go to Cape Town. These are the things that we have to get from the clinics, and when it is. In South Africa as a whole, I see a progress for the young trans women and trans men living in South Africa. It will be more accessible. Manje kusenzima, but in future I can see ukuthi it will be easy. It will be lovely to have access to go to the clinic, not to go to the private hospital and pay so much, and to go in a public hospital, get them, and then to do our bottom surgeries, public hospital. The struggle that we face now, it will be much easier for them to not access my hormones in every way. It's very depressing. I'm not gonna lie to you, it's very easy. You get moody, react different. Some good to they can cope. Abanye, they end up going suicidal. I get very depressed. I get edgy. Angwazi kuba stable. Ngibe mina. You know what? When you grow up, you know who you are, but you can't express who you are. That's a silent killer. To not get much information, okay, who you are. To not be around people that talk the same language. Okay, this is what we want. You get depressed. You need to get information. Do your research properly. Research. Google. Okay, this is who you are. I don't want to lie. I don't want to pretend. I need to be honest and be truthful. Political parties, they abuse us. They abuse us in every way. They always use the LGBTI as a front, but they don't deliver. They can speak, but actions are winning. Human rights, trans rights are the same. Why do we have to have boundaries? Okay, this is where it ends. Igcina la into. Mase sivotile senza yonke into. Everything is gone. We can't even ukuthi sikwazi ukuvoice out. We voice out, but we're limited. Ukuthi sikhulume ngezinto ekanje. Let have somebody also stand out. Each and every political party say what? I'm out. I am me. Healthcare system, they need to upgrade. Public hospital, everywhere, they need to be educated about us. They need to be educated about we human. Treat us the same. Treat us the same. South Africa as a whole. Ngiyacela ngiyanxusa kuwona wonke umuntu. Political parties, stakeholders, whoever. To not group us. Ukuthi makuthiwa sifanele senze ama-surgeries. To call this a beauty thing. I-beauty ayibe yodwa, nale ibe yodwa. Ibe easy, accessible. Like ukuthi siyokwenza yonke operation esiyoyenza ibe accessible kunoma ibani. We human. Let us be who we want to be. Embrace it. singancishwa amathuba asingancishwa lutho asikwazi ukuthi kuvuleleke yonke into singancishwa kungavalwa ukuthi fanele ngize ngiye ngaphandle kwenye indawo ngiye ku Cape Town ngiye kuphi la ngikhona kuziphi ibhedlela ekhona kuma provinces ethu easy access for us for trans people. I thank you.
Igama lami nguMesule wakwaHlatshwayo. I identify myself as a trans woman. I was born in KZN, it's Newcastle, in 1996, May 15. I work for Trans Hope as a peer educator. Uma ukuthi awuyitholi i-support emndenini as umuntu trans, akubi lula ukuthi uphume la emphakathini cause kufanele ukuthi kuqale khona ekhaya. Uma uqala ekhaya ukhululeka bakwamukela wathola yonke i-support oyideservayo, and then uma usuphuma usuya la ngaphandle kuba lula cause noma kuthiwa awuyitholi i-support ngaphandle kodwa uma uyithola ekhaya nawe uyabona ukuthi at least ku-right cause ngiyayithola i-support ekhaya. Whenever abantu bafuna uku-accessa ama-gender affirming health services manje esikhathini samanje abantu abakwaziyo ukuthi bethole lawo ma-services kuba ilabo bantu nalabo or angathi mhlampe ngathi abangani or bayasizana mhlawumbe umuntu uzokhuluma nomunye ukuthi hawu uma ufuna ama-hormones kanje kanje zokwenza kanje and then thina-ke esingenabo bo-connection or esingabazi abanye abantu or esingasibona abangani nalabantu laba abaphophula thina sisala kanjalo emumva izinto zethu ziyadileya noma kuthiwa kufanele ubone i-psychologist it's fine uyayibona i-psychologist kodwa angazi ukuthi indaba izinto nje uma ufuna ama-hormones kuyadileya awasheshe uwathole. Manje mangicabanga-ke for in future angazi ukuthi kuzokwenzeka kanjani cause angiboni ukuthi kuzoshintsha uma ukuthi kuyakwazi ukuthi kwenzeke namanje even ne-generation enye nayo ezayo izobe iphinde iqhubeke yenza ngale ndlela kwenzeka ngayo manje. So into eyenzakalayo kwabanye bethu laba esingakwazi ukuthi si-accesse lama-services esiwadingayo akwenzeki kahle akubi right cause uyayibuza ukuthi wena ingoba kanjani ungakwazi ukuthi uthole lama-services ekwazi ukuthi abanye abantu bewathole. Mina nje as one of the trans people since mina ngakaze ngiwathole lama-services manje inkinga ngiyahlala nabantu abakuma-hormones manje so nami I don't feel like woman enough ukuthi nami shuthi I'm not a woman, I'm just a trans woman on social kuphela. Right ungafanele ukuthi bakwenze ukuze wonke umuntu ezokwazi ukuthi athole i-access to lama-service lawa kufanele ukuthi at least kube nama-branches yonke indawo or mhlampe yonke i-facility ikwazi ukuthi provide ama-hormones for abantu aba-trans nokuthi bekwazi ukuthi befundise ama-service providers kuwona wonke ama-facility ukuthi baphathe kanjani abantu abaku-LGBT because abakwazi ukuthi bebaphathe kahle. I-role engakwazi ukuthi idlala ama-political parties in making sure ukuthi ama-voices ethu ayazwakala ukuthi ama-political parties shame nawo angazana amanga awakwazi ukuthi agcine iy'thembiso but into engiyibonayo kunga-right ukuthi kuwona wonke ama-political parties at least bekwazi ukuthi be-point umuntu okwi-LGBT ozokwazi ukuthi ebe i-leader yethu so that kuzokwazi ukuthi kube lula even though noma kuthiwa bale kwezinye indawo khona izinto abayikhulumayo sazi nathi ukuthi khona umuntu owethu osimele ozobuya esinikeze information e-right cause bazosithembisa ukuthi sothola into ey'thize kanje and then abawa-deliver lawo ma-services esuke siwafuna. Okay, so what I would like to say to all the stakeholders out there, ngingathanda ukuthi ngisho ukuthi cela bandla ukuthi bengathembisi izinto abangakwazi ukuthi bayigcine. Ngingakhuluma futhi kakhulukazi kwamaphoyisa. Amaphoyisa awaphathani kahle and then wona lamaphoyisa la kufanele ukuthi engabe wona asivikelayo iwona abeka iy'mpilo zethu engcupheni because masifika sihambe siyoriphothela amaphoyisa ayahleka wodwa abizana wodwa. Please ngicela nithathe iy'mpilo zabantu aba-trans ukuthi niyithathe serious nathi sabantu siyathanda ukuphila kanjengani or at least if besizokwazi ngabe sakwazi ukuthi siyikhethele impilo nasi bese singesize sikhethe ukuthi siphile le mpilo esiyiphilayo kuzothi uphuma la emnyango wena ubona ukuthi uhlukile kunomunye umuntu no akukho right na wonke umuntu uyafisa ube engathi unormal vele indaba vele mina ngizale ngibe umuntu kanje engconiswa ngabe intombazane straight or ngabe ngumfana straight nathi siyathanda ukuthi sifane nani abantu abasisi.
Sanibona, igama lami nguJoe Wahlophe, ngizalelwe eAdams kwango-83 September 11. Ngihlala eMlazi sengakhilela ka-UI Shelter esiza ama-LGBTI. Ngisebenza ka-Transhope as a peer educator. Mina I identified myself ngokuthi I'm a trans man. A trans man, which means I'm a man in my house. Mangibiza uJoe as ngi-LGBTI. Ngithe mangifika ka-U ngahlangana nengqinamba zokuthi abantu bakhona eMlazi la bebengayithandi inhlobo indlela engiphila ngayo mina ezokuthi ngizofundisa ingane imikhuba zizokwenza into abangayazi. So ngazama ukuba understandisa ukuthi ngumuntu nami ngiyaphila and ngilungile ngiyawuthanda umphakathi. Ekuhlukumezekeni kwami ke so abantu abaningi bangazile ngoba bengisebenzisana nawo umphakathi ngizama ukufundisa ukuthi an LGBTI asinawo sasanezimo sabantu siyaphila. Then kwase kuqhamuka ingane yokuqala eyafikayo yayikade nenkinga kubo, yayikade ihlala nogogo wayekade umngani kagogo wami beqhamuka emakhaya. So gogo bengalifuna ibhlukwe engafuni ukuthi ihlale izula iyovakashela abangani befanele ihlele endlini. Yangichazela isitori sayo ukuthi ngihlala nomngani kagogo kanje uyangihlukumeza eza understand impilo engiyiphilayo. Ngathi if ukwazi ukuthi ungeza kohlala nami sibambe la ngesilale singadlile ungakwazi ukuthi ufike uze sizohlala. Iyona ngane yokuqala ngahlala nayo 2010 endlini till now. Isikhathi esiningi imindeni yethu akukholula ukuthi yamkele indlela esiphila ngayo. As mina ngikhule nogogo benga-understand inhlobo ekuthenini ula ekhaya uyintombazane thile uzofunelwa indoda ugcina usunengane bajabuliswa yilokho kodwa wena kube ngakwanelisi as umuntu ufuna ukuphila impilo yakho. So ekhaya bayacindezelana ukuthi sifuna ukuthi uphile lempilo okuyiyona wena ongayithandi egcineni end up suhamba uhlala nasemigwaqeni usungesenayo indawo yokuhlala gcina usubanjwa abantu umuntu akuthembisa izinto ezingekho. So ngizama ukuprotecta izingane ezama LGBT ngoba ngihlala nezingane ezisancane nginami. Ingane ze-LGBTI eyihlukumezekile back home uthola ukuthi ithenye ngingede ekhaya bengibizela amakholwa nginenkinga ngiyagula sho ngigula ngekhanda even umzali kuyena omjikelayo. Izimo esibhekana nazo thile kuze kube ukuthi uhlala nabantu abangazona izihlobo zakho ngenxa yokuthi abazali ekhaya abanayo impatho bona. Kwi-shelter lenginayo ngifisa ukuthi kukwazi ukuthi kubiyeke asibiyelile and ngakhe ngothayela and amakamera khona mancane akasanele sibaningana manje ngoba ingane ngihlala nazo zingaphezulu kwa5 ekuyizona engiyigadile. So ngifisa kube khona imbhede, ngifisa kube khona kwakhiwa ngeblocks isakhiwe right because nasendlini ngena ngisho amanzi abanye balala phansi uthola ukuthi ngimanzi ngisho sona isponge la balala kusona. Ngifisa nje into eziningi ngayo ukuze bakwazi abantwana ukuba safe because ngiyazama ukuba protect abantwana bami kodwa amandla amanye abuya ngiphelele ngoba usiza ngiluthola kalula. Ama services okuyiwona alula abangawathola abantu aba LGBTI kuba ba trans ilawo ukuthi umuntu mayefuna ukukhuluma ne-psychologist sike sihlangane noChris as mina ngihlangane noChris efonini besikhuluma ngefone ukuthi yena ngibhekana naziphi ingqinamba ngifisa ukwenza njani in life. So angizange ngize ngimbone but abasondelene nami bayakwazi bona ukuthi baye eMaritzburg sebeke baya as ama services abewathola khona ngisho ama hormone bawalanda khona ngale koChris esibhedlela sabo. Mina ngikufisayo ukuthi kube seduzane konke kusondele eduze kwethu. Thina sisonkana singaloku sigibela sitravela masifuna ama hormones mase kube right kuthiwa akasondezwe emaklinikhi bakwazi ukufundiswa abantu kabanzi ukuthi mangabe ukuthi umuntu ulanda ama hormones kumbe umuntu ufuna ukwenza into ethize as trans kwenziwa kanje kuke kufundiswa nesibanikeza knowledge yakho lokho kungabi kude kakhulu nathi. Ngibona kubalekile kakhulu ukuthi ama-political party ahlezi enathi because if njalo makuthiwa kuyavotwa asikhishelwe eceleni nathi siyavota. Kufanele sinikezwe nathi amathuba okuthi sigadeke asigadekile thina abantu bagadene bodwa kuye kubekwe abasibekwe thina as trans nathi sibe nezindlela zethu zokuthi sigadene because nathi siyaphila siyadinga ukuvikeleka. Engifisa ukusho nje as thina ama-trans nama-stakeholders nje sicela ukuthi bandla ke nibambisane nathi ekunikeza abantu ulwazi ukuze sikwazi nathi ukwenza into zethu yisheshe njengoba suke kwenzeka kushesha nje ngisho siyavota. Ninikeza abantu bethu futhi amathuba emisebenzi. Ngiyacela ukuthi nizivulele iminyango nathi sikwazi ukungena.